little bit the order. So I start with language, then move to bilingualism, and then to culture, because I think that in this way, probably it's easier to explain, but all three things will be mentioned today. And I also mention here my Twitter handle. I use Twitter a lot because I think it's a very, very good and convenient way of sending links to talks, to papers, and so on. So if any of you will join me, I will, the next 1-2 days, I will send links to a lot of papers that I was mentioning and so on. I think in this way we can kind of communicate very easily. And if you have any comments, please just, put my handle into it. Okay, so starting with language, very, very often bilingualism is perceived as something very, well, unusual. There are studies showing bilinguals are better in this or worse in that, develop dementia. So in a way, the default setting for a lot of research is monolingualism, and as I will be arguing in a moment, monolingualism in a single language, namely English. And there is a kind of, I always like to start with, with the beginning of the world. And there is, of course, the biblical idea of the Tower of Babel, that in the beginning, everybody spoke one language and one speech, and only later on, the languages developed into different directions. Now, of course, Bible has in New Testament another very interesting place, namely the Pentecost, where in fact it was the Holy Spirit who allows people to speak in tongues, speak in different languages. So you can find arguments in both directions in the Bible. But what I find interesting is, if we look at the, can you see the slides changing, I hope? Okay, so if you look at the mythology, multilingual creation myth, for instance, in Australia, you find a very, very different way. So here, the ancestral Warramarungunji traveled from Indonesia under the sea and then started setting up people having distinct land, food, and language. I very much like the connection of land, food, and language, and food, in fact, apart from language, will also feature later on in my talk. So from this point of view, I mean, one of the papers that I wrote with my colleague Suvarna Alladi, who I'll be mentioning later on again, is we said that bilingualism is very common worldwide, and might have been the original state of human communities, and our brains are extremely well suited to support it. So from this point of view, I would say there are reasons to believe that human language developed in the context of multilingualism, with people speaking different, very different, often structurally and lexically languages. Now, this is still the case in much of the world today. So if we move beyond, some of the nation states of Western Europe, North America, particularly beyond the Anglosphere, we will find that people are still very multilingual. And I remember one situation, so that's the picture here on the left, the upper picture, when I was, so I mentioned that, it was the original form in many societies, and it's still very much there. So I was speaking to an audience at the African meeting of African Society for Neuroscience, and then one of the first questions was, one of the guys with whom I'm now in contact on Twitter, Tom Tago, said, well, sir, that's all fine, but in Ghana we speak all 3 or 4 languages. Is it an advantage to speak 5 or 6 or 7? So that is the kind of the baseline. Another example I have here is a shopping list from Hyderabad written in different languages. But what I want to mention is, it's also the case in the West. So if you work in UK, in Western Europe, in US or Canada, you are very, very likely to find patients speaking different languages as well. And the reason I have this picture of Bern is because that was the very first place when I started working in psychiatry in Bern in Switzerland. And my very first patient was a Somali patient with whom I couldn't communicate. He spoke Somali, Amharic and Arabic, whereas I couldn't speak any of those 3 languages. So from this point of view, this is an issue, important question everywhere. And then I would say it was recognized in the early days of aphasia research by the founding fathers. So if you read, for instance, Arnold Pick, although the research was predominantly until 45, conducted in German and French, he recognized in his famous book about agrammatism from 1913, he recognizes that aphasia will demonstrate itself differently in different languages. And indeed, he was multilingual enough to give examples and predictions. For instance, languages that don't have infinitive cannot obviously use infinitive as a unmarked form in Broca's aphasia. So Arnold Pick was certainly one of the kind of early masters who understood the importance. But since 1945, we have a dramatic dominance of English. There was a little bit of increasing interest in cross-linguistic studies inspired by Elizabeth Bates, but unfortunately going down a little bit after her untimely death. And about 10 years ago, I was looking with a student of mine through aphasiology papers, and we look at three main journals in aphasiology, and 61.4% of papers were based on people speaking English, 7 German, 6 Italian, and so on. You see all Western European languages. Chinese was the highest non-Indo-European with 2.5, and then Hebrew and Japanese, and by Japanese we are under 1%. So basically, the vast majority of papers has been on patients speaking either English or one of the closely related Western European languages. But what is even more important is this difference was much more pronounced when it comes to number of citations. So here we have theory building. Practically, out of 7 papers over 50 citations, they were 21 papers, 5 were on English, 1 was Italian. Papers which had more than 50 citations were only English. So that means all the theory building happens in English, and then maybe it is being used in other languages. And equally or even more important, in case of aphasia treatment, 85% on English and 90% on the 3 languages, English, German, and Dutch. So that means patients across the world are being often treated as if they were English speakers, whatever their first language is. But you could say, does it matter? Are language differences relevant? Or maybe all languages are just minor variants of a universal language. So studying one language is enough, and then we can, on the basis of one language, show universal truths. I hope to show you in this talk that this is not the case. And in fact, here I have a very interesting paper by Nick Evans and Stephen Levinson, The Myth of Language Universals, Language Diversity and Its Importance for Cognitive Science. So it is recognized more and more that their differences are important, are relevant, and are relevant also for our understanding of cognition. And that means that specific features of languages need to be taken into account for diagnosis and treatment of diseases. Now, languages can differ from each other in different ways. Firstly, sounds, the most obvious one, phonetics, phonology, prosody, how the language sounds. Words and underlying concepts, that would be lexical semantics, grammar and underlying relationships, morphology, syntax, social context like pragmatics, and registers, dialects, which would be area of sociolinguistics, and also written language, different writing systems, or difference between written and spoken language. And in all this, we can have very important, significant differences. So let me start with the kind of the most obvious, that's what we first hear, and that's the phonology. So we have, for instance, the phenomenon foreign accent syndrome, which can be described in traumatic, vascular, epileptic, and progressive aphasia patients. But the interesting point is, very often the language sounds strange to the native speakers of that language, but they have a hypothesis which language it is, and that depends very much on the way, on the languages that people are used to hear. So it's and we know of cases of progressive aphasia, for instance, that started, let's say, with a southern Italian patient who never left southern Italy, who has never been north of Rome, let alone abroad, speaking now suddenly, for instance, with a Spanish accent, or what was perceived by Italian speakers as a Spanish accent. Then we have papers suggesting that, for instance, melodic intonation therapy, one of the main treatments in aphasia might be different depending on the nature of the language. I realize that the idea of syllabic versus stress pattern languages is problematic in linguistics, but because the dichotomy is not as clear cut, but there are clearly differences how languages are structured, and they can influence the way how, for instance, melodic intonation therapy works, could work, and so on. So transferring a melodic intonation therapy program from English into a language with a completely different sound structure might not be a good idea. And it might also have influence even on our brains, like this study by Jenny Crinion, where they were comparing Chinese and English speakers, not just ethnic English and Chinese, because there were also ethnically non-Chinese speakers of Chinese in the group, and found higher density in right anterior temporal lobe and left insula in those who spoke Chinese, with the idea maybe that could be due to the fact that this is a tonal language. So I would expect, by the way, similar results, for instance, in people speaking Thai, which is, of course, another tonal language. Then we have words, semantics. So there are different ways, for instance, of mapping semantic space. Color terms are very, very famous. Now, some aphasia tests, like aphasia test, looks at naming of colors. This is not banal, because the color boundaries can be very different in different languages. We have the question of derivation morphology. So, for instance, in many languages, you have a lot of similarities with practically, so to say, you have a root or maybe a stem, whether it's a Semitic or an European language, from which different words are being produced. And why is it important? Because, for instance, in aphasia, if you have a naming test, if a language always uses the same form, then you can get away with just naming a drawing picture. But if you have languages which have a lot of different forms, you have to know them in order to use the language. So, for instance, if I have English house and house is always house, then it's fine. But if I use it in Polish, I have to know the forms don, domu, domie, domen, and so on and so on. If I do the same in Tamil, I need to know not only vidu, but vittuku, vittuka, and so on and so on. So here we have a lot of differences which might impact aphasia. Sentences, that's one of my favorite examples. Asking and answering questions. In many treatments of aphasia, the first thing that is being taught to patients is to say yes and no. Now, a lot of languages don't have words for yes and no. I mean, starting, by the way, with Scottish Gaelic, or in fact, Old Latin didn't, you had to repeat the verb. So in Gaelic, for instance, you have to repeat the verb. And similar things you will find, let's say, in Chinese, where basically you ask and negate and or confirm the sentence differently, whether, let's say, you have shibushi or yo-me-yo. So from this point of view, it's not banal to say, okay, well, you just teach patients yes or no, because they might not be really appropriate words which universally can answer any question with yes and no in different languages. And then another nice example which I like is expressing time. So in English sentence, I was at home yesterday, you have a kind of double marking for past. Was suggests that it was yesterday, and the term yesterday suggests as well. In Chinese, when I would say 我昨天在家, then it's the 昨天 yesterday, which suggests that it was yesterday, because there is no grammatical form that would say that it was something in the past. So here you have clearly a lexical marking of the past. In Hindi, you have something opposite. When I say मैं कल घर पर था, then kal can be both yesterday or tomorrow. So it is the syntactic, the different form of the verb, the grammar, ha, ka, which tells that it was yesterday and not tomorrow. So from this point of view, languages use different ways, and that could be, again, very important if we want to teach patients to use it. Now, I mentioned messages in social context, expressing politeness, choice of words, different forms of address, grammaticalized politeness. As far as I know, again, I would assume it probably the case in Thai as well. Many East and Southeast Asian languages have very, very elaborate systems of using different form in different social contexts and so on. I mean, starting with the fact, I mean, the only thing I know in Thai is basically that, for instance, as a man, I would say Sawadee krap, but I think a woman would say Sawadee ka. So again, you cannot even translate simply the sentence without knowing, for instance, whether the speaker is male or female. And that means this might not be a relevant feature in English, but it could be a very relevant feature in speakers of East and Southeast Asian languages. And then also there could be very different, let's say big or smaller difference between the written and the colloquial version of a language. I mean, in some languages, in Arabic, it's almost like two languages. The dialect is very, very different from written language. In others, they are relatively close together. Most languages have a difference, but let's say the linguistic distance between the formal written form and the colloquial form can be smaller or bigger depending on specific language. And finally, enough in written language. I mean, here I have a nice example because Japanese is kind of, ideal example because here we have basically a mixed system which has both a phonetic alphabets, in fact, two of them, the kanas, katakana and hiragana, but also the kanji, the ideograms taken from Chinese. And here you will find that, in fact, different parts of this writing system can be impaired in different language disorders. So Watanabe in 1893, which is to my best knowledge the first description of in Japan of an aphasia, described a selective kana impairment with phonological deficit in patients with motor neuron disease. Then Imura, for instance, in the 40s, probably what is the first description of semantic dementia, what we now call semantic dementia, it was a kanji impairment with semantic deficits. So from this point of view, it's interesting because, for instance, looking at that, I then started looking in European languages. And funnily enough, you don't find many errors in English. Why? Because in English, in fact, there's very little phonology. You have to learn the words by heart. The phonology gives you very little hint how to write a language. So in fact, those spelling errors were much more discovered in Spanish and Italian. So depending on the language, in the same disease, the same type of phonological deficit can cause different type of disorders. Now, in this case, I find particularly interesting because, of course, in English, we always assume that irregular spelling is more difficult. However, if you go the semantic route, then the irregular spelling might be the default because then you try to translate it into, so to say, via meaning, the semantic route, rather than via phonology. So this is just a kind of view why I think languages are not only are fundamentally, and I would say fascinatingly different, but why these differences might be relevant for aphasia manifestation and aphasia treatment. And one thing which maybe before I move to kind of more practical examples I would like to mention is that if we look at the relationship between languages, the usual way of doing it is to look at, so to say, at the genealogy of language, genetic or genealogical approach, in which we look at languages coming from the common roots. So let's say Indo-European languages or Tibeto-Burman languages or Austronesian languages and so on. So common origin with subsequent divergence. Now, this is very interesting from a linguistic point of view. However, the differences are not always obvious. So let's say for a linguist, it's clear why the Latin word factum became hecho in Spanish is absolutely regular, but it might not be so obvious on the surface. What I would say is more important from the way how we see cognition is that we look at typological approach where we look at primary structural similarities, and then we can have convergence, including language contact. And here, for instance, in Europe, a nice example is Southeast European languages, Greek, Serbian, Bulgarian, up to Romanian, and so on. For instance, absence of infinitive, using of inflected form as well. And then, of course, South and East and Southeast Asian languages would be another example where languages might come from very different sources, but might develop very, very similar features. So in a way, the way I say it always is that the origin of language is like about siblings. But if you have, let's say, a couple of brothers and sisters who then move to completely different countries, have different professions, marry very different people, after 50 years, they might become very different from their siblings and very similar to those they live with. So we need to look at languages not necessarily just how they develop, but also language contact, language change, depending very often on the neighboring languages. And that's why I would say, depending on topic, different types of language comparisons are interesting. Okay, so that's, so to say, explaining why it is. So now I want to kind of convince you that there is indeed evidence that we have that aphasia is not the same in different languages. So for instance, grammatical gender. I mean, we find this is not a feature of English, as far as I know. It's also not a feature of Thai or most East or Southeast Asian languages, but it's a very, very common feature in the European languages, but also in Semitic, Hebrew, or Arabic. And here, it is relevant for aphasia. So for instance, in German, it was found that patients might be better in naming when they are cued with the article, which also includes information about the three genders of German. In Spanish semantic dementia patients, you will find the opposite. They might lose the knowledge. They still know the word, but they lose the knowledge about the correct gender. So for instance, words like idioma, tema, or dogma, which are L in Spanish, or they finish with A, will be generalized to A. Use of pronouns, so that's the paper I have here on the right side, where patients with Bengali speakers with Alzheimer's disease were underusing pronouns, whereas the English one were overusing it. So we have, again, the same disease, different languages, and in this case, not only different, I would say opposite ways how the disease is manifesting. And then inflection morphology, which I mentioned, it is not only important to have naming tests beyond nominative if the language uses inflected forms, it's also important in terms of treatment, because very often in most, let's say, Western European languages, we assume that the nouns are easy, so nouns are introduced first and verbs later on. In Slavonic languages, where you have a lot of different inflected forms of nouns, in Luria's model developed for Russian, for instance, it was verbs in imperative which were first, and nouns were left for the last thing. So what is easy and difficult might be different in different languages. So that means treatment cannot be simply taken over. Just to give you some more examples, Broca's aphasia and agrammatism. In Germanic languages, that's what you find in most textbooks, which were based on observations from German and then English, is agrammatism and telegraphic speech, omission of function words, use of uninflected verb forms. So basically the idea is the patients put things together without grammar. In morphologically complex languages, there is no use of uninflected forms, no infinities, no bear steps. So in a way, you find a very different clinical picture. So I think we should revise our idea of Broca's aphasia, saying what we know is basically in a small number of languages. Now, for instance, I don't know how is it in East Asian languages, where the grammar will not be usually conveyed through more, prefixes or affixes and so on, but maybe through, for instance, different particles and so on and so on. So a lot of work needs to be done before we have a really universal idea what Broca's aphasia is. So as I say, what I observed in patients with Polish, what I know from literature about Russian or Serbian, Serbo-Croat, or Greek and so on, is that, as I say, the patients don't use infinitives. Often they cannot because the infinitives don't exist in the language. They don't use bare stems, which are non-words in that languages. They will usually use inflected but incorrectly inflected forms, and they do not omit function words. So a very different picture depending on the language. Now, in Wernicke's aphasia, paragrammatism is similar. Traditional view is paragrammatism, paraphasias, what in German was called Satzverschränkung, and so parts of the sentence put together with comprehension deficits. But in morphologically complex languages, you find phonological errors in the stem, but usually not in inflections. And you find something which I call inflectional salad, where basically different inflections are put at the end. So here the example from Polish, czuję means I feel, czułam means I felt, and here the patient says czujęłam, which basically means to feel, present, and past. So basically the both tenses are being merged. Now again, you will not observe this if you are only confined to languages where basically there is a relatively small number of morphological endings, like for instance in English. And then, you know, little bit of fun, adaptation should not be literal translation. Here are some nice examples what happens if you translate things literally. So I particularly like the grilled sexual harassment, and I think the Spanish speakers in the audience will appreciate how vino de la tierra has been here translated as he came from the earth. Now, vino de la tierra in this case means the wine of the country, but in fact it is correct. You can also interpret it as a vino being he came, and then de la tierra from the earth. Also, by the way, helado, frozen helado is ice cream, so it's not quite correct. Then another example here, for instance, we have a nice wall, very well meant in Madrid, where they wanted to be very nice to everybody. But for instance, Hebrew, they apparently didn't realize that Hebrew is written from right to left. So shalom is written from left to right rather than from right to left as it should. And in Arabic, they didn't even realize that usually connect the letters rather than put them like this. So in a way, you do get a little bit of problems. And the other thing is here with a Burger King in Belfast, which is saying yes. So it's assuming that every language will have a word for yes, but the point is, I mean, the shi in Chinese is basically to be rather than to have. So maybe yo would be a better choice. Now, so generally, the point is, it's not just about words, it's also about structures. So for instance, a lot of tests in English are based on the idea that passive is the kind of classical grammatical transformation. So you test the grammar only by use of passive. Now, in many languages, passive is not used that much. So for instance, in Polish, my native tongue, as it happens, you rarely use passive if you want, for instance, to invert the actor and the recipient, because the grammatical endings tell you already. So you don't have to say, if you say boy kisses the girl, boy and girl are grammatically marked. So you can change the order and you know who is doing what. You don't need it. So the idea that passives are always the best way of testing grammar is not necessarily correct. And as I already mentioned before, what is difficult can be different in different languages. In many languages, verbs might be more difficult, but in some languages, in fact, the inflection of nouns poses considerable problems. So this is, so to say, why I think that, you know, we really need to look at specific languages rather than just doing our research in English, develop treatment, and then pretend that everything is universal. What happens now if a person who speaks more than one language develops aphasia? So I'm now moving to bilingualism. As I mentioned, the majority of population in the world is bilingual. Well, in about 76%, so very, very often, both languages are equally affected. But you have also differential and selective cases of aphasia. So basically, either patients might have one language more impaired than the other, or the recovery is faster in one language than the other. In both cases, it's relevant because at some point in time, there can be different levels of impairment, different languages. And one very important practical question is the generalization of treatment effects from one language to the other. Can I treat in one language and will it improve also the other, or will it be specific? Still research questions that are open where there is research, but we need much more evidence. Now, if there is a distinction between two languages, the most intuitively kind of clear and first described pattern was so-called Ribot's law, that the first language is best preserved, but Soon, in France in 19th century, Pitre described the opposite pattern, where the last language was best preserved. So attrition of the first language. There were other cases where emotionally most relevant language was best preserved, even it was not the first, not the last, or the relevant language after the recovery, what the patients were basically exposed to after their injury was the most relevant. And in fact, even cases like a famous case by Albert Obler from 75, where you could have a patient having a Broca form of aphasia in English, but Wernicke in Hebrew. So this is an aphasia. So there can be differences between different languages. What about dementia? Well, it's a very interesting story, because even in normal, healthy individuals with aging, language shifts happen across the whole lifespan. So it could be that we use different languages in the youth, in the middle ages, and in later life. The often described pattern is reversal to the first language, but it's not the only pattern. So it's not a banal question, which language or languages should we use for cognitive testing? We can get different results in the same patient and arrive at incorrect conclusions if we maybe don't take this into account. And in fact, the reason why I put languages is because in some cultures, it is very usual to mix languages and to use what is now called code switching. So in a way here, you need to use both languages in order to test the patient in an ecologically valid form. So the idea of having just testing one language might be problematic. This is, for instance, very often the case in India. Now, here we are doing some studies where we are kind of looking with here one of my PhD students, Brittany Blankenship, or in fact, she just submitted, so she will be soon a PhD herself and a postdoc. She has, so we are looking at reports of language changes in people over 50. There is one version for people themselves, anybody over 50 can report it, and some for friends, families, where you can report about your family members, friends, people you knew, even about deceased ones. We got almost 300 responses, but this is still open. I will have it on the last slide, so you are most welcome to join it. I would be very interested. The more results we get, the better. What we can see already now is that there is a lot of different patterns. So reversal of the first language is common, particularly in dementia, less so in healthy aging, but there are also other patterns with attrition of the first language and sometimes with mixing, uncontrolled mixing. So I was speaking about code switching, which is, so to say, in this case, well, wished for or normal in certain cultures, but you have sometimes people who, in fact, want to separate languages, but not able to do. So we have a lot of different patterns and much more study is necessary. And bilingualism itself can also influence both aphasia and dementia. So here are studies which I did with my colleague Suvarna Alladi from Hyderabad in that at that time. I mean, now she moved to Bangalore, to Nimhans, and basically we looked at the study of Białystok, who was the first to observe a delayed onset of dementia in patients who are bilingual, but the problem was many of their bilinguals were immigrants. In Hyderabad, this place has been multilingual like much of India for hundreds and hundreds of years, if not millennia. So from this point of view, we could dissociate here the effects of immigration and language. And indeed, we found also, by the way, a great place to do it because they have excellent clinical services, multilingual tests and stuff. So people can be really assessed in the language of their preference. That is, for instance, very often not the case in some other studies, let's say, done, for instance, many studies done in the US, where everybody is assessed in English, which could be mother tongue of some patients, and in fact, the third or fourth or fifth language of others. And we found also 5 and 6 years in illiterates, and difference between different aphasia forms. Now, I've been fortunate to do more studies with Suvarna. So we also looked in stroke patients with the opposite question. So here, the question was, we expect something opposite. If bilingualism has a good effect, a positive effect on cognitive reserve, you would expect people to recover faster from stroke. And that's exactly what we found. So there was no difference in age. So bilingualism doesn't prevent you from having a stroke, unfortunately, but the outcome was much, much better in bilingual monolinguals. And although a roughly same percentage got aphasia, global aphasia was much more common in monolinguals than in bilinguals. Now, the last thing, so to say, before I move to culture is, and in fact, that is already on the verge of culture, and that is a topic I got very interested recently, is use of different languages in therapy. So we know from many sociolinguistic studies, for instance, East Africa, people where most people are speaking 3 or 4 languages, they use the languages differently, even the same conversation, in order to, achieve something or stress something and so on. So we found that in psychotherapy, patients use consciously, they switch to English, for instance, if they want to distance themselves from their emotional experiences, and then they switch to the African language where they want to produce stronger emotional involvement or maybe an emotional bond with the therapist. So in a way, multilingualism can be used, is naturally used both by patients and by therapists in order to regulate emotional distance. Okay, so now a couple of last slides about culture so that we have some time for discussion. Now, here we move one step further. So are pictures culturally universal? So maybe if words are different and sounds and sentences and so on, once we have a kind of abstract picture, it should be always the same. Well, firstly, the objects themselves might not be very clear across cultures. So let's say I have a picture on the igloo because here below there are some pictures of me working on Guam in the Pacific. And I remember when I was seeing one of the research groups working there, and one of the naming tasks was igloo. Now, if you work on a Pacific island, igloo might not be the best item to test naming. But on the right, you have tweezers, which, for instance, are very widely used in some countries like US, for instance, to cut the nails. Well, it's not that in other cultures people don't cut the nails, but they will do it with other things. They will do it maybe with a filer or with a small scissors. So again, so the objects themselves are not universal. But then you can have objects that are universal, but a context which is strange. So here on the right, you see 2 eggs, and the question was, are they coming from a hen or from a swan? Well, this is part of pyramid and boundaries test. And as I was doing it again on Guam, I was surprised that patients didn't recognize the eggs. I mean, they use eggs a lot. I mean, fried rice with eggs is one of the favorite dishes, until I realized they would never put egg into an egg cup. So here, for the Western, so to say, participants, make things easier and disambiguate them, that the egg is there, make practically the same object almost not recognizable in the context of a different culture. Now, I could imagine that in Thailand would be similar, that you have certainly a lot of eggs in your cooking, but not necessarily in egg cups. Then the symbolic meaning can be different. Now, if you look on the right, I mean, firstly, already, for instance, here in the middle, we have a kind of picture of a man and woman, and we know always that this will be toilets in Western Europe and North America, because this is the place where basically the genders are being separated. In other places, not. In other countries, I mean, let's say in Dubai, I remember when I entered the bus, I had to realize that by error, I went into the female part of the bus because it was separated. I didn't realize that. So other countries can have different things where genders are separated. But what I find interesting, on the right hand, this is a toilet in Poland, my native country. And if you are a man or a woman, which of those two would you go? When I was a child in Poland, I always thought we did it to make it easier for foreigners who might not speak Polish and don't know what is the difference between mężczyzna and kobieta. But in fact, it is not universally clear. In this case, just to disambiguate, the triangle is for men, the circle is for women. So what we think might be universal is far from being universal. And then the last point, drawings versus objects. Why do I have a plane here? Because we always assume that people will recognize drawings as a representation of objects. I remember sitting with a colleague of mine, Ratnavali, in Nimhans in Bangalore once, many years ago. And then she was testing a patient who could not name this picture of a plane. But then, as it happens, we were testing outside in the beautiful gardens of Nimhans, and then a plane was flying over. So she said, "What is this?" And the patient immediately said, "Oh, it's a plane." So that means people or cultures might be less or more used to these symbolic drawings. Here, I have one of my favorite things. In fact, one of my PhD students who just submitted was working on these different picture descriptions, very often used in aphasia treatment. Now, here in the middle up, you have Boston Diagnostic Aphasia Examination, the famous Boston cookie theft. Now, it is clearly dated, and you can see on the right side that a modern picture, politically correct, is showing, for instance, now a man doing the washing up and the woman in the garden, and so on and so on. So the question that, you know, the roles are not quite as they would have been in the 60s. But here, for instance, on the right, you can see where a version which I have from my colleague Apurva Puranik, who did a lot of work, in fact, on pictures in India, where basically a woman will be dressed in sari, so she doesn't look as strange to the speaker as would be the case. Now, on the left, you see the famous Western aphasia battery picnic scene. Now, even for me as Western European, this is a very much middle-class North American scene. I don't think I have ever been in a place like this. So I recognize it only because I know it from the books about North America. Now, it will be even stranger for someone coming from a very different culture, let's say in Asia or in Africa. So here you have below also examples how pictures need to be adapted. And interestingly, in this PhD, what my student did was to look what happens when we show now non-European pictures to our Scottish participants. And they are stunned and they produce different results. So they produce usually, interestingly, more complex vocabulary, maybe because they are struggling to describe the objects they don't know, but usually simpler syntax, maybe because they pay more attention to the vocabulary. So that means it does matter which kind of picture you are showing. The results will be different, and we could see it, as I say, I like the idea of reversing the tables and not always have Western pictures being shown to non-Western participants, but having it the other way around. A very popular test, or a popular at the time test of frontal executive functions, was a computerized test where the people can prepare breakfast. And the idea was, of course, to have an English or Scottish or American breakfast, cooked breakfast where you have to put the toast and so on and so on. But breakfasts are very different in different countries. Now, here I have three of my favorites. Brazilian breakfast up on the right with fruit, maracuja, and so on. On the left, Japanese breakfast with miso soup, with rice and fish, and then Tamil breakfast, idli and vadai with sambar and coconut. Now, we cannot simply assume that everybody across the world will do it. I would be very interested, maybe you can inform me what the kind of traditional breakfast in Thailand is. I know quite a bit about Thai food, which is delicious, but I don't have memories from my few days in Thailand how the breakfast has been. And just to kind of round up, we are coming to the kind of conclusion slides, visual spatial functions. So very often, for instance, here on the right, you can see right the upper picture, you can see the wired cube, which is often tested for visual spatial functions. Doesn't even work very often well in Europe. Like, for instance, a colleague of mine, Chandra Garcia Caballero, showed in his work on people with only 3 years of education in Galicia, where basically they had struggling with it because this is something people learn at school. The perspective thinking is not very, so to say, necessarily universal. And Suvarna, whom I mentioned, Alladi, I mean, from Hyderabad and now Bangalore, for instance, she was doing a test where basically Indian patients were tested with Rangoli, which is a very ecologically valid incredibly complex visual structure, but something that is indeed practiced in the cultures. Now, on the left, I have pictures of traffic in Sweden and in Italy. Why? Well, the first patients with frontotemporal dementia that were diagnosed in Lund in Sweden many, many years ago were sent for medical testing by police because they were caught 2 or 3 times speeding. And the police's logic was, a normal person wouldn't do it. Something must be really wrong with them. Now, I know an Italian colleague always said, well, in that case, we would need to send, most of our population into the scanner. So what in Sweden, indeed, and the police was, by the way, correct, because those patients did have frontal atrophy. So what in Sweden would have been a completely unusual behavior would be an absolutely the same, normal one in Italy. And I remember one occasion where I was coming back from Brazil, where, I spoke with everybody everywhere, and then standing in the queue to buy my tickets from London to Cambridge, I was trying to do the same, and I realized people started, looking at me like, should we call a psychiatrist or a police, because this guy is speaking to everybody. The same, so to say, behavior, but very, very different across countries. On the right, tea and coffee. What is better for cognition? Well, it depends where you are. So for instance, in UK, tea is usually associated with lower social class because coffee was a kind of, for a while, now it's probably less the case, but in older people, it would have been a special drink. So people who drank coffee also would have probably had, a healthier food and maybe olive oil and so on their food. So in fact, coffee was associated with healthier lifestyle and better cognition, physical health. In Japan, where basically tea is associated with more traditional, healthy Japanese food, and coffee is more the marker of people who will also eat hamburgers and pizza and so on, you have exactly the opposite picture. So basically, whether we take visual spatial skills, behavior, factors associated with behavior, they are substantial differences, relevant differences across cultures. So let me now wrap it all up. Now, what is the minimum that we should have? We should need assessment and treatment based in language and culture of respective patients, and we should have adaptations instead of translations. Direct translations are inappropriate and can lead to incorrect results. Also, treatments need to be culturally acceptable. So here I have, for instance, 3 ways how, let's say, different Asian cultures develop to maintain people in their, through aging in their healthy stage. But what should be the ultimate goal? Well, I would say the ultimate goal, we should be more ambitious. The theories of cognitive function are important because they are those which give then rise to assessment and treatment. So the theories of cognitive functions, the resulting assessment tools and treatment methods should grow out of a broad basis of cultural and linguistically diverse material. So not do the test in English and then look, oh, does it work maybe also in Thailand or in Japan or in Brazil, but pull together information that we have from the whole world and then develop our theories and the resulting assessments and treatments. Which underlying functions do we want to assess? We should ask ourselves. How are these functions expressed in specific languages? Which actions and behaviors do they correspond to in different cultures? And for me, it's not only about social justice and cognitive decolonization. It's about learning from the whole world that will benefit the whole world. And that's what I would like to finish with. So I think we need to overcome linguistic, cultural, and cognitive egocentrism. We should decolonize cognitive assessment and treatment. The whole world is a lab. And how you can help, the last thing, these are the 2 surveys that we are currently running. And as I say, I will be posting more materials about this talk and papers that I refer to and so on my Twitter.